Good morning, Namaskar, respected chairperson, distinguished guests, ladies and gentlemen. Myself, Professor Dr. Bishnu Prasad Sarma from Guwahati, Assam. Today I will speak on osteoarthritis and its management through Ayurvedic drugs, a novel approach. So according to Ayurveda, Vata, Pitta, cough, when it remains normal, then we maintain our health. Any diseases occur, that means there should be imbalance in the Vata, Pitta, cough. Osteoarthritis is called Sandhigata Vata. Sandhi Vata in Ayurveda. It means a condition in which morbid Vata is located in the joints and destroy the joints. According to Ayurveda, osteoarthritis occurs due to aggravation of Vata dosha at the joint and called as Sandhi Vata. Osteoarthritis, which is also known as osteoarthrosis or degenerative joint disease, is a progressive disorder of the joint caused by gradual loss of cartilage and resulting in the development of bony spur and cyst at the margin of the joint. The name osteoarthritis comes from three Greek words meaning bone, joints, and inflammation. According to World Health Organization, osteoarthritis is the second commonest musculoskeletal problem in the world, 30% after back pain, 50%. In India, it is as high as 12% of India has the second largest osteoarthritis patient base around the world. So evidence this large carnivorous dinosaurs have this osteoarthritis problem. Bats and sloths are the only known vertebrate that do not develop osteoarthritis. The reason these mammals are immune to the condition is simply the amount of time they spend just hanging out upside down. So these are the diagnostic criteria. I will not take more time. So holistic approach. There are plethora of treatment options available in Ayurveda. Treatment goals for the patient with osteoarthritis of the knee include reduction of pain, improvement in joint mobility, improved quality of life, and limited functional impairment, avoiding drug toxicity. A clinical study was done at Government Ayurvedic College and Hospital, Department of Kaya-Chikitsa Ayurvedic Medicine on 60% of osteoarthritis. A main object to study the efficacy of ashwagandha krita basti and oral polyharbomineral compound in the management of osteoarthritis. To observe and evaluate the effect of ashwagandha krita matra basti and oral polyharbomineral compound and to establish treatment modality for osteoarthritis in modern era. So these are the investigations we did before and after. Treatment procedure. The ashwagandha krita basti 50 to 60 ml was administered in the form of matra basti after proper snehan and swedana for 10 days along with the basti and oral polyharbomineral compound was given in the dose 1 tablet twice daily for 3 months. Follow-up studies, every patient registered for the study underwent 3 follow-up, each 1 month interval. The results were assessed with improvement in pain, restricted movement of the knee joint, crepitus, swelling, morning stiffness, and radiological findings. This is a compound drug. It contains gugulu, godonti bhasma, rasna, arjuna, ashwagandha, bola, kukudanta bhasma. We give in the tablet form. This is one composition, gugulu, this godonti bhasma, rasna, terminalia arjuna, ashwagandha, root is used. Bola, then Kukudantok Bhasma, then Ashwagandha Ghita. It contains Mursita Ghita, Ashwagandha Kalka, Ashwagandha Quat, Godukta. This ghee, pure cow ghee, and herbs used along with ghee, Horitaki, Bibitaki, Amlaki, Nagarmotha, Horidra, and Nimbu Soras. Nimbu Soras, Horitaki, Amlaki, Bibitaki, Mustak, and Horidra used along. This is the ghee was prepared as Ayurvedic pharmacy at our college. After preparation, we kept in a jar, glass bottle. Inclusion criteria. Patients with complaints of knee joint were included for proper diagnosis. The age group between 30 to 70 years, pains without any previous anatomical deformity. Exclusion criteria, patient below 30 years and above the 70 years, patient suffering from disease like carcinoma, psoriatic arthritis, HIV, tuberculosis, SLE, syphilis, cardiac disorder, pregnant lady. So after treatment, 13%, 27.7% could walk 25-meter distance in 30 seconds. 20% patient could walk 30 to 40 seconds before treatment, which was steadily increased to 24-40%. In between 40 plus to 50 seconds, the number of patients was 27, which was decreased to 14%. And between 50 to 60 seconds, the initial case was 20%, which was decreased to 9%. And lastly, patient unable to walk only one. In initial case, which was decreased to 0. Pain is also subsided from 2.1 to 1.08. Restricted movement is also comes down. Taking into consideration of the cardinal signs and symptoms, pain, morning stiffness, swelling, restricted movement, and crepitus, the clinical assessment of the result established as markedly improvement 26%, 43.33, moderately improvement 33%, no improvement 1%. This is the procedure. This is how we give Matra Bosti. Before treatment, we did X-ray. After treatment also, little bit gap is increased by giving treatment. You see, by before treatment, patient unable to sit in the floor, but after giving treatment, patient easily sit in the floor, walking distance increases, patient can climb the staircase. You see how he sit in the floor before treatment. You see how improvement was there. He can sit easily in the floor.
Good morning. I am Prasad Bishnu. I teach English at Budani College, Manchester. So I was suffering from knee joint pain. In both the knees, I felt acute pain. For long 3 months, I was suffering. But I came to Government Ayurvedic College in the first week of July, and I met Dr. B. Sarma, HOD Medicine, and Government Ayurvedic College, and he suggested me to undergo conservative therapy in this government hospital. And since 12 July, 12 July, I have been undergoing treatment in this under conservative unit. And now, after 7 days treatment, I feel almost 50% relief from pain, and I feel comfort. And I sincerely hope that this sort of treatment will be efficacious or fruitful in joint pain, and I hope this is the right result. Okay.
My name is Kaveri Chaudhary, 63 years of age, a retired teacher by profession. I have been having this knee pain and a bit of lower back pain. So I had come to Dr. Bishnu Prasad Sarma, under whose treatment I am, and he advised me a therapy called Vasti therapy, and I have finished 8 days of that. And during that therapy, I have got a lot of comfort from what I was suffering. For instance, I had difficulty climbing downstairs. Now, I am much, much comfortable climbing downstairs, and I do not have to take one stair but 2 steps at a time. Then my back pain is, you can say, 95% cured. And for me, 95% is 100%. And I have been advised now more medicines, the same medicines actually, carry on for another month or 2. I will carry on with those, and I'm sure, and I'm positive in fact, that I will be cured. Oh, okay. The haunches which I could not sit properly, this is about 80% I can say. Okay?
So this is the improvement. Again, you see, before treatment, patient unable to sit, but after treatment, patient can sit in the floor easily. Lots of cases are there. Patients are happy after getting their treatment. So the drug therapy is effective in controlling pain, restricted movement, swelling, morning stiffness, and crepitus of the affected osteoarthritis knee joint. Statistically positive and effective response of the trial drug was also found. 33%, 55 were markedly improved, 26%, 43.33 were markedly improved, and 1% was not improved. The walking speed of the patient was increased. The pharmacodynamic properties of the trial drug satisfied the Chikitsa Sustra of Chandigata Bata osteoarthritis, the BOSTI with its specific action, and also the trial drug with its Bijja Guna and Rosayana property could regress the disease progress. Thus, the clinical symptoms was reduced and they could perform their daily activity. Patient could sit well on the ground, although they were not allowed. We can conclude that Ashwagandha Ghita Basti and the oral polyharbomineral compound is effective to reduce the clinical symptoms of the disease. Moreover, it also increases the walking speed and mobility of the patient. Thus, with a hope that the present study will pave a path for scientists and researchers working in the field of this disease. Thank you. It is a very good and effective treatment. Thank you, sir.
Okay. Let me thank Dr. Bishnu Prasad Sarma for his very interesting presentation on Ayurveda, how it can help in the cases of osteoarthritis. We don't have time for questions now because we've got another presenter, Mr. Martin Rickinger, but Dr. Prasad Sarma, if you stay connected with us, maybe there will be space for some questions later. So we'll be happy to join you later if you have time, of course. Let me ask first Dr. Bishnu Prasad Sarma, are you still with us? I can see you. If you can hear us.
Yes, sir. Yes, I'm there.
Thank you very much for staying with us. And there arrived some questions. So may I read them for you?
Yes.
They are not in chat in Zoom. I've got them here from YouTube, from our listeners. So, can a layman use Ayurveda for osteoarthritis, or is it too complicated and we need a specialist for that?
Yes, Ayurvedic specialist is required for such type of treatment. I showed for osteoarthritis, we have a very good treatment, but he or she has to take the treatment from the expert doctor only.
So, as usual, it is always better for such a specialized disease to consult a specialist, of course. What about availability of some of the agents or some of the formulas, some of the healing or medicaments, Ayurvedic that you mentioned? Are they available in Europe, or how can we from Europe get to them?
But right now, whether it is available or not, I don't know. But at India, I can provide all this. Or at India, medicines are available, or in hospital. Our hospital, it is available. But in other Ayurvedic hospital also, such type of facilities are there. But in Europe, right now, I cannot tell you in which hospital or in which center it is available. It is available. If somebody, I can give the training because Ayurvedic people are there. If they can invite me, I can show how such type of therapy can offer to the patient. Because last year also I showed one case regarding transverse myelitis. It is very difficult, but with the help of Ayurvedic treatment, I presented through your seminar last year. So if anybody can help me or invite me to give training, I can give the training. And medicine is available. They can bring the medicine from India.
That's great. So the best way is to get in contact with you and your hospital, and from there they can start.
Yes. You can. My email is also there. Yes, you can circulate my email, my phone number. Okay.
And you are also listed in the program with the contacts on you. So thank you for that. May I have another question? Have you got a little time for another question, or?
Yes. I'm there. No problem.
I think you already described it a little you described it in your presentation, but here's a question. Can Ayurveda cure even an advanced stage of osteoarthritis? I think that you showed some of the examples of an advanced osteoarthritis, but there's a question, so if we can enlarge on that a little bit.
Yes, we can, but patient has to come in the early stage. If complete ankylosing is there, if knee joint is complete ankylosing, then we cannot show any good result because it will take time to progress the disease. It will not in a one day, it takes time. If the early stage patient comes to Ayurvedic physician, Ayurvedic doctor, if take treatment from Ayurvedic doctors, generally improvement is there and patient will feel well-being and no need to change the knee joint because according to modern ultimate treatment is knee replacement, but after replacement also problem is not subsided. So if the patient comes in the early stage, if he takes the Ayurvedic treatment, but he can enjoy his life without changing whatever God has given us this knee joint.
Thank you very much for your kind answers to the questions from our listeners. And since in your highly specialized field of osteoarthritis there are no more questions, thank you for your kindness and for the time that you
Okay, thank you, sir. Next time also, if you invite me, I can personally visit your country also. Okay.
Okay. Thank you for that offer.
Yes, I know you, Stina. Stina is there, no? Director Stina. Do you know her?
Stina, it's the name or surname or lady or a man or
A lady.
Stina.
Stina.
Stina. I'm wondering who it can be from the organizing committee or who.
Maybe. Exactly, I don't know. Sometimes
Yeah,
I talk with
I will
her
mention
over
it.
phone.
I will mention you to the board, and somebody definitely will raise his hand that he or she is in contact with you. If you want to stay connected, you are welcome to stay connected.